Good morning, everyone, and welcome to this COVID legal compliance session run by Kaizen Synergy Law Firm. My name is Nihal Samara. I'm the General Counsel and Legal Director here at Kaizen Synergy, and I'd like to welcome you all to today's session. Today's session continues a series of webinars that we're delivering as part of our COVID safety legal compliance program. Our law firm has been running these webinars since February back 2 years ago and running these each week on key topics that not-for-profit and community service organisations really need to know about. We are focusing this particular series on the coronavirus and Australian workplace laws and covering off key topics that yourselves need to be aware of. As always, we'd like to pay our respects to the elders past and present upon the lands on which we all meet. While this session is being run by webinar and recorded, we do pay our respects to the traditional owners accordingly. So today's session really builds on the previous 5 or 6 sessions that we have been running. We are taking apart the COVID requirements for workplaces, specifically focusing on community service organisations. We are seeing now a big shift in responsibilities being moved from state and Commonwealth governments onto employer agencies. And what I mean by that is quite simply there in 2022, the ideas of lockdowns, the ideas of who's going to be responsible for really COVID safety is now being pushed in many ways back on employers. And this is quite simply what we are seeing right around the country. So with that, we have covered off some specific topics. These are built off the Fair Work directives published on the website, and a lot of this material is actually pulled from both Fair Work Direct website, which we do acknowledge, and also Safe Work Australia as well too, in terms of the information and documentation. Rather than reinventing the wheel, we openly acknowledge that, but also add to it. So what we have seen around with community service organisations is many agencies grappling on, well, what does this mean for us? As rules start to relax around the country, we are still seeing now a huge number of people with COVID-19 presenting, being admitted to hospital. There's challenges within the workplace. What about policies? Do we continue to screen people? A lot of the QR codes have been lifted and reduced in some states. So agencies are then turning around and going, what do we do now? Are we meant to not have the QR codes? Are we still meant to do contact tracing? What is our work health and safety obligations? Even at executive levels, board levels, CEOs levels, our law firm has been approached by agencies saying, look, we've heard from staff that they think we don't need to screen people anymore because we don't need to check in anymore. What does that actually mean for us? How do we then manage risk, health and safety in our workplace? So it is actually real issues that agencies are finding that they're having to deal with. And a lot of these questions are being dealt with different opinions by exec managers, CEOs, compliance officers and the likes. We've had one agency that called us last week and said, geez, we ran an event and also we had a work health and safety officer actually just randomly show up. And we're seeing this actually happen all around the country as well too. So what does it actually mean? Well, essentially what we are going to give you is a bunch of tools that you can use. And we know these tools work. It is something that agencies have been using for the past couple of years and really all the way through the COVID pandemic right up to today. And as these tools have been changed and updated with all your legal compliance obligations around it. So as always, many of you have seen we always put the recommendations at the start of these sessions. And with it, from today, you can actually jump in, start using these tools as well too. You can use it as much as you want. You can use it as least as you want. So whether it is just a reference guide or whether it is something like a lot of agencies have done, quite simply to actually implement policies and other templates that we've actually given you coming out of today's session. And really, the best thing is we know that it works because we can actually show you real life case examples of what other agencies have done to make COVID safety compliance simpler within their agency. So one of those things which you have seen is the Gemba dashboard. It is something that is available to all agencies. We have opened it up. You will have the COVID assessment tools that agencies are continuing to use. You've got Gemba Docs, which gives you the policies and procedures on templates, and also the risk register that we will show you today in terms of some of the key areas that you really need to have a look at. So we've drilled it down into really 3 separate areas to actually look at this morning. So when we look at COVID safety in the workplace, today's topic, we are focusing on health and safety. So when we look at the sites, and as I said, I'm going to refer back to Fair Work and also Safe Work. Fair Work updated their information back in February 2022 on their website. We have gone up to date, and actually even this morning done a review from a legal compliance perspective on the information we are sharing. These slides will be updated over the next few weeks as well too, and information and all of the attendees. I can see people asking questions already. By all means, use the chat group if you do have any questions coming up today, and we will get through to them. So yes, we will be updating all of the information that we do send out to you, and quite simply, you can access our past webinars via our Gemba 360 YouTube channel. And if I bring those up for you to view, and here is our website, you can access it through here, but you can also access our past webinars, which have all been made public directly on our Gemba 360 YouTube channel. And you can see that here, and that has a list of literally all the past webinars that we have run, and we will get a link to that today. So when we look at this with the work health and safety, let's be quite clear from the start that all employees are required to take care of health and safety and welfare of workers, customers and visitors to your workplace. These workplaces can include sites. It can include all of the places where your agency essentially works from. So with that being said, there is a positive obligation for you to ensure that you minimize COVID within your workplace, and this will be an ongoing requirement, and it really does fall under work health and safety obligations. As part of that, there is an obligation to also protect employees, clients and visitors to your agency's sites. Now, the challenges that you do have is when we look at this is, and you would have seen my slides that I have put up, which do cover the specific requirements on unpacking some of these obligations. So when we look at risk health and safety, we need to look at health and safety in the workplaces. What about going to work and protecting employees and customers? And really, that's our focus today. Now, essentially, from a compliance point of view, what you do need to be aware about is that there are document management obligations. So apart from the work health and safety rules, there's also legislation around the country that actually require you to hold on to documentation. And this documentation, for example, in Victoria, is which we list under the Crimes Document Destruction Act, which was actually changed, which was an act commenced back in 2006, so quite a few years ago now, but it actually created an offence for the destruction of evidence, of documentary evidence. So there is a positive obligation for things like policies, for work instructions, for COVID assessments, assessment forms that staff or people might complete, to how you demonstrate is what I'm getting at, of COVID safety in your workplace. So how do you actually demonstrate if a WorkSafe inspector came in that you've done all that is reasonably possible to actually do? And that's really what health and safety is about, doing all that is reasonably possible or expected within your agency. So essentially, this is the documentation that under law you really do also need to keep, and it's also important as part of your record keeping obligations. So under workplace health and safety laws, employers have to do what they can to ensure health and safety of their workers and others in the workplace. And let's be also quite clear, if I go back one slide, thank you, that employees also have responsibilities. So it is both, it is two ways. It is not simply the employer's responsibilities, but it is also the employee's responsibilities too. Now, what does that actually look like if you do have forms that you have? And I'll come to this on the Gemba dashboard, which you do have. Now, some employees who want to stay home as a precaution, how do you in fact manage these? Well, some employees may want to stay home as a precaution. And Fair Works, when we say Fair Work encourages employees to discuss their level of risk with contracting coronavirus with their doctor, their work health and safety, or workplace health and safety body as well too. So employees who want to stay home, who haven't been directed, and this is those that haven't been directed is who I'm covering here. For example, under a enforceable government direction, will need to come to an arrangement with their employer. And now keep in mind, this is the current situation we find ourselves in. So if people want to actually stay home as a precaution under current measures, and there isn't a enforceable government direction, then Fair Work are actually informing employees to come to an arrangement with yourselves. So how do you in fact manage this? Well, employees who are requesting to work from home or taking some sort of leave, such as annual leave or long service leave, may actually be able to do that. Now, this is quite frustrating for employers because you're trying to keep your business and operations open, but employees want to stay home as a precaution. Well, one of the forms that I'll show you is around the COVID assessment form. So what are the measures that you're actually putting in place to ensure safety in the workplace? Now, if employees who stop work because it's unsafe, aren't taking industrial actions, do actually need to comply with the directions of your agency and to perform other appropriate safe work that is direction that is reasonable. Now, it may also be that when we've had situations like this with some, for example, migrant services, where they've had to shut down their entire operations because there's actually been an outbreak of COVID within their workplace. And so many staff have actually came down with it that they actually shut down their, it was a agency decision to actually go into lockdown, essentially, and they stood down their staff as part of this. But again, under work health and safety laws, employers have to do what they can to ensure the health and safety of workers within the workplace under those laws. Now, how can you effectively do this? Now, let me just show you how agencies are doing this within their workplace. Now, two things have essentially come up, okay? One of the things is around having registers for vaccinations, and whether it is under mandatory vaccinations or not, what some agencies have asked their staff is essentially to keep a register of their staff's vaccination status, because essentially and it's an optional issue, it's an optional discussion here for some agencies. I'm not going to go into the part whether you decide whether it's mandatory or not. There are policies under our templates that allow you to access this information as well too. Now, someone's just asked, can you show us where the actual policy is? And we can certainly do that for you. Let me do that for you right now. So with it, if you go into your Gemba Docs icon as well too, let me bring this up for you. And if you actually go into the policies and procedures. Here we are here. Okay. If you have any questions, I will add that you can actually click on this live chat link, and our support desk will be here to assist you as well too. So you can go into your policies and procedures, and you'll find that we do have a ton of templates for you to use. And one of those is the COVID safe work health and safety policy template. This is open for all of you to actually action. And if I open this up, here it is here. And thank you, Angela, for asking this question. I will get to that as well too. So I'm just going to open up the Word document for us to view. And it is just a Word document. Here it is here. And quite simply, you'll see that we've got it set up so that way it literally is insert your agency name and you're up and away. And you can actually utilize this document. Angela has just asked, which is a really good question, about how does this work with people's privacy? So essentially, Angela, what we're asking is there's a couple of ways to actually manage this. So the first part of this is with the privacy requirements. Essentially, what you're looking at here to start off with is who is actually vaccinated within your agency. Essentially, what we do ask people is either you can update your privacy policy, or you can essentially say the reason that we're asking this is to put in measures to protect people who are either vaccinated or unvaccinated as well. So essentially, if people don't give it to you, then you can, and this is across all of the public health directives, whether it be in Victoria, New South Wales, and the likes, if someone doesn't provide that vaccination information, then essentially you can mark them as unvaccinated. So you do give people the option around that, but it means that they're not being discriminated against in any shape or form around it. And it is the option to be able to do that. Now, you'll find that in the HR space, if I go into license around this, we've actually got, and we've actually updated it to each of these. What it gives you is the vaccination details, and you can keep a register very quickly of all of your essentially employees, volunteers, members, and contractors as well too, should you wish to do so. Now, the other measure that I will add on this is, and remember, these are strategies that other agencies have actually used on this, and I'm showing you real life case examples of what people have done. The other part that people have done is actually set up their own check-ins. And what I mean by that is that Jembra is designed to be mobile. So essentially what we've got is a symptom checkup. And quite simply, if I scroll down, people are asked, do they have any of these symptoms? And it's simply a yes or no answer. The reason for this is that you're checking whether anyone that is, before they start work, are actually presenting with any of these symptoms. And if they are, then they're asked to, you're monitoring them and sending them home if they need to be. So very, very quickly, and I'll come to this with long COVID, very, very quickly, you've got two very quick and easy routes to screen any of your staff or personnel, but also visitors as well. So we've got childcare services that are actually screening people, and this is essentially as a first measure of actually asking, have people any of these symptoms, and if they are presenting, then essentially you are managing it directly from there. And it's actually sending you an alert if anybody actually says, yes, they are. Now, when we look at this as part of these requirements, essentially you're having a first measure. And we're finding that agencies like migrant resource services and the likes, and outreach workers, community health centres are all using this. And it's a very, very quick way for people to actually self-assess around this. Also, from an employer's point of view, you can't discriminate against employees for raising health and safety concerns. So if someone actually does raise a concern about, well, what measures are you putting in place to protect us, you can't actually stand them down. So employees can't be dismissed or injured in their employment because they have responsibility under work health and safety laws, such as if they're required to quarantine or self-isolate. We've in the past also mentioned, and I will mention here, about stand downs and enforceable government directions as well. So you can't simply stand people down. Now, Fair Work do have an employee checklist, and we've actually sent this out to agencies in the past. This checklist is also made available on the Gemba dashboard, and it basically gives you a kind of workflow of what you actually need to do before standing somebody down. Now, it's also important that as part of the workplace that you have these things in place. So when we talk of COVID safe plans, one of the things that agencies have done is to look at, well, what things do we need to have in place? Now, when you go to Safe Work, there are a range of there are 3 different things that they focus on. And those 3 different items that they in fact focus on, if I go back to the start of my slides, is these. And Fair Work have actually identified that under health and safety in the workplace, health and safety is a topic, going to work, like what I just showed you, is a topic, and protecting employees and customers is a topic as well too. So what we have done to show you this, and let me just jump to this, it'll become very, very clear of how you can actually manage this very, very simply, is this. Is when we go back into the Gemba dashboard, we have taken those topics and placed it into the risk register. And you can see those here. So essentially, each of you now have on that a risk register in your Gemba dashboard with these 3 topics. And these include protecting employees, customers, going to the workplace, and health and safety. Now, by simply opening this up, and I've just marked it as red on this, we can now say, okay, we've got protecting employees. How are we doing this? Well, we have a screening tool, and I'll do this live for you, that all personnel complete each day to confirm, to assess if they have any symptoms for COVID. Okay, simple as that. Now, the other one is the screening tool. If you may also want to do this for other clients that actually visit your agency as well too. And we're doing the same thing. So essentially, you've got 2 very clear measures in place. You might also then have our policy. So we also have the policy document, which all personnel are aware about. Okay, so these are the really clear current controls that you have, 3 current controls. You can then minimize this down to, yes, it could be likely that we have it, and you can then update that you're going to review this, let's say, in a month's time. So if I do, let's say, do this, and I'm just going to mark it for the 18th of April, sorry, the 22nd is the last review date, which is today. The next review date I'm going to set for, let's say, in about a month's time, and the completion date I want it done by the end of next month as well too. And you can select actually yourselves directly from this as well too. Here we are here, and I've got the list of people that we can then have, and this is our demo group. I can click on save, and here this is now being updated. So very, very quickly, if a workplace inspector comes in, what we've actually then got is the Fair Work information of the 3 categories to actually look at. We've taken those 3 things of what Fair Work have required, put that into the risk register, and then said what we're actually going to do. You've got access to the policy, you've got access to the screening tools that we know other agencies are in fact using, and you've got access to your vaccine register as well. And if people aren't giving you the information, then as Angela pointed out, look, yes, you can treat them as unvaccinated, and you've got the information to say that you've asked the question. So you've done all that is actually reasonably possible for your agency to actually carry through. And so with these forms, we've got agencies like Aboriginal community controlled organisations and health and aged care services that over the past number of years, as staff have actually, or personnel have actually come in, and they might have large agencies of 300-400 odd staff, and they've got 40,000 forms that they've actually completed, as part of that to date. We've got agencies as small as literally where the CEO is also the cleaner, is also the office manager, and they've just done it as part of their general day-to-day. It literally takes seconds to actually do. So you can see very, very quickly that these tools, it means then that it's supporting your business and operations without it being such a huge and difficult task for people to actually look at doing. The other parts that we do have from last week, which talks about the returning to work. And again, Fair Work have had the checklist tools around this, and some of this is targeted to small business. We've incorporated these into your Gemba dashboard and also added in some of the workplace forms, and this includes the risk assessment that I've just shown you today. And so as part of these tools, you know that you're meeting your Fair Work obligations as Fair Work rules and also Safe Work rules change. The compliance dashboard is also being updated for you. So it is a very, very straightforward and simple way of managing all of your risks within agencies. As I mentioned, this is things that other agencies like yours have worked. Now, one of the things I will mention is around long COVID. It is something that is coming up and important for you to be aware of. And you'll see this across my other slides that I have mentioned. Now, long COVID is essentially a case where people might have had COVID in the past, but the symptoms are actually persisting. So it may be that they're actually testing negative, but essentially what we are seeing is that they do have common symptoms 12 weeks after their actual positive test that they've got. It doesn't mean that they are still positive. So current estimates suggest that around 93% of absences related to COVID-19 sickness lasted for less than 30 days, and over 99% have lasted for less than 3 months. However, there is a small percentage of people that are actually having persistent COVID symptoms that we are now seeing. So with it, as part of this, it is important that you be aware of what these are. Agencies are taking measures already in place to manage this. This is why these forms that we are talking about, from not only a Fair Work compliance point of view, but also Safe Work point of view, that you actually look at utilizing these resources because they are designed to support your agency. Now, with this, I do see that a few people have asked questions from this group, and these have included much around the actual cost of the Gemba program as well too that we are seeing. And with it, you will find that we have set this up. So this, the purpose of this is to give you access to all of these resources. Now, quite simply, and this is something that we have opened, if I go back to our website, and you will see this at kaizensynergy.com, our system, our compliance system has been running for over 10 years, and it's almost approaching 15 years now. For the COVID works, quite simply, we have opened up the Gemba dashboard. It gives you, all of you, access to these as a single seat to access the Gemba Docs, the HR and pandemic modules as a no-fee approach. And you can access these today. It gives you access to all of the resources that I'm talking about today. Obviously, if you open it up to other people within your agency, 2 or more people, then there is a subscription fee that comes with it. And that gives you access to literally all of the modules once you have the subscription fee. And that includes everything from client record systems to HR systems, compliance calendars, legal updates, and the likes. But in terms of the COVID safety dashboard that I've shown you today, you'll see it here. It gives you access to these resources to literally start using today. And it is something that we have opened it up over the course of this pandemic because we know it works, and we see that other agencies are already using this. So quite openly, that is something that is available for your agency to access, and it gives you access to these resources. I cannot make it as more simpler than that. There is some 6,500 agencies that have been onboarded over the last 2 years that actively utilize these resources as well too, and we're more than happy to do that. I can see that a few people have asked us in terms of our recommendations. Yes, access your Gemba 360 dashboard and review the policies, review the tool list and slides. We will be sending all of these resources out to your agency to utilize starting today. Our support desk will reach out to each of you today to ensure that you are supported and also ensure that you have access to the legal resources and you can get one-on-one support for this. As always, we open up the phone lines to and chat lines to answer any questions that people might have. If you are watching today's session if you are watching this webinar after today's live session, then by all means, please reach out to us on 1300 360 360 or email us directly at support@gemba360.com.